If you, or maybe someone you know, is thinking about conception, especially later in life, the statistics can feel a bit, well, daunting. The truth for women over 35 often isn't about the ability to carry a pregnancy, but it really comes down to the quality of the egg itself. That age-related dip in egg health, it often shows up as chromosomal issues or just a lack of cellular energy. That's the big reason success rates fall, particularly as women approach their 40s. But what if there was a way to help unlock that cell's potential? Something simple, non-invasive, something based on physics. We're going to talk about an emerging approach called low-level light therapy, or photobiomodulation, PBM for short. Specifically, we're digging into one particular wavelength, 830 nanometers near-infrared light. Okay, let's unpack this.
Absolutely. And our goal today is really to go beyond just the surface level stuff, beyond the stats. We want to explore the actual nuts and bolts, the cellular mechanism of how this 830 millimeter light works, and then look at the clinical evidence, which is quite compelling, showing how it impacts ovarian health and, critically, egg quality. Because, as you said, that age-related decline in egg quality, think diminished ovarian reserve, damaged eggs that just can't form viable embryos, that's the main hurdle we need to address.
Right. So if we're talking about these fundamental cells, we need to talk about their power source. Frame this energy challenge for us for the aging egg.
Well, you could almost think of the egg, the oocyte, as one of the body's high-performance vehicles. It's incredibly energy-hungry. It needs a massive amount of ATP. That's the cell's fuel. It's energy currency made by mitochondria to do its incredibly complex job.
Maturation, fertilization, those first critical divisions.
Exactly. It's a huge task list.
It needs a full tank, basically.
Precisely. But with age, those cellular powerhouses, the mitochondria, they start to fatigue. They become less efficient, accumulate damage. And this slump in ATP production, that directly leads to lower ovarian reserve, more oxidative stress, and eggs that are, frankly, too tired or damaged to successfully complete fertilization.
Okay, so the core issue is mitochondrial fatigue.
Yeah.
The power plants are running down. How does gentle, non-thermal light, just light, reverse that, how does shining a light on the abdomen suddenly give these cells a huge energy boost? This is where it gets really interesting.
It really is. And it all comes down to targeting things very precisely at the molecular level. LLLT uses very low power densities. Importantly, it's non-thermal, so there's no heating involved. The light gets absorbed by specific molecules in the cells that are sensitive to light. We call them chromophores.
And deep inside the mitochondria, the critical chromophore we're focused on here is
That would be cytochrome C oxidase, or CCO. It's a key enzyme.
the gatekeeper.
Exactly. It sits in the electron transport chain within the mitochondria and essentially controls the flow of energy production. Now, in cells that are stressed or aging, CCO often gets gummed up, inhibited by a molecule called nitric oxide. You can picture nitric oxide as causing a little traffic jam right at the energy production exit.
Okay.
So when that 830 nanometer light hits CCO, the light energy it absorbs is just enough to dislodge, to sort of kick off that inhibitory nitric oxide
It clears the traffic jam.
instantly. It restores the smooth flow of electrons, and that immediately ramps up ATP synthesis.
Wow. So it's not a small tweak. It's like clearing a major roadblock, a targeted surge of energy right where it's needed. That handles the energy deficit. But you also mentioned damage, toxicity.
Yes, that's the other critical piece. Failing mitochondria, they produce a lot of waste products, reactive oxygen species, or ROS. Think of it as cellular exhaust fumes. For aging eggs already burdened by this ROS, the increased mitochondrial efficiency driven by the light leads to a significant drop in that oxidative stress. We've seen studies showing maybe 30 to 50% reductions in ROS levels in treated cells.
That's substantial.
It is. And beyond that, this energy boost also supports DNA repair mechanisms and significantly reduces inflammation in the ovarian environment. Part of how it does this is by dialing down the activity of a key inflammatory pathway known as NFD.
So it's like flipping off the chronic stress switch?
In a way, yes.
Yeah.
Calming things down at a fundamental level.
Okay, that makes cellular sense. But why 830 nanometers specifically? If it's just light absorption, wouldn't any red light work? Could I just, use a standard red light panel?
Yeah, that's a really important question. It gets down to physics. The wavelength is critical for two reasons: how deep the light can penetrate into tissue and how effectively it's absorbed by the target, CCO. Remember, the ovaries aren't on the surface. They're deep, maybe 4 to 6 centimeters down.
Right.
Visible red light, like 660 nanometers, is great for skin issues, maybe even helping sperm motility because the testes are superficial. But it just doesn't reach the ovaries effectively.
It gets absorbed or scattered too soon.
Exactly. Now, 830 millimeter near-infrared light hits what's often called the optical window or the Goldilocks zone for deep tissue. It penetrates really well, up to 5 centimeters or sometimes more, because it scatters less in biological tissue. And crucially, it's still absorbed very efficiently by CCO without getting blocked too much by hemoglobin in the blood or water in the tissues.
So it's that sweet spot, deep enough reach, specific enough absorption. What about other near-infrared wavelengths, like, say, 850 millimeters? Is 830 really that unique?
Well, 830 millimeter consistently comes out on top in clinical studies for this application. While 850 millimeter might penetrate well, the absorption by CCO seems to be optimally tuned around that 830 mark. You risk overpenetrating, essentially passing through the target without delivering the optimal therapeutic dose if you stray too far. The clinical protocols really emphasize sticking close to 830 millimeter.
Okay, that consistency in the research makes sense, but I do have a question that, well, some listeners might be wondering. If this mechanism is so effective at the cellular level and non-invasive, why isn't LLLT, standard practice everywhere in IVF clinics already? What's holding it back?
That's a fair point. It often comes down to a few factors. One is simply the time it takes for research to translate into widespread clinical practice. Many of the really compelling studies, especially those on tough cases, are relatively recent or involve smaller groups. And secondly, it's often seen as complementary, not a replacement for IVF itself. Integrating new technologies into established medical workflows takes time, validation, and sometimes overcoming a bit of inertia.
Right, the adoption curve can be slow, even with promising science.
Exactly.
Okay, let's get back to those results then, because the data you mentioned earlier, especially for women who've struggled, sounds really significant. What are we seeing in real-world outcomes?
The results are genuinely striking, particularly for women facing the biggest challenges. There was a clinical overview looking specifically at severely infertile women. Many of these women had histories of multiple failed IVF cycles. They tried conventional options without success. Treatment with 830 millimeter LLLT resulted in a 21.7% pregnancy rate in this group.
Wow, 21.7% after previous failures. That's not just a slight improvement, that's a major shift for those individuals.
It's truly life-changing potential. And it's not solely about fixing the egg in isolation. The therapy also seems to really boost the function of the granulosa cells.
Those are the support cells around the egg.
Precisely. Think of them as the egg's crucial support team. They provide nutrients, manage hormone signals, basically create the right environment for the egg to mature properly. By revitalizing these granulosa cells, LLLT improves the whole neighborhood the egg lives in. This leads to better fertilization rates and, importantly, healthier embryos down the line.
I see. So you're optimizing the entire local ecosystem. And women using this therapy are reporting things like better embryo grades in IVF, which huge for implantation, and higher implantation success rate.
Yes, those are commonly reported improvements. We also see positive changes in markers like antral follicle count, which gives an idea of ovarian reserve, and sometimes more balanced estrogen levels.
Makes sense. And what about blood flow?
That's another key aspect. LLLT is known to improve microcirculation. Better blood flow to the ovaries means more oxygen, more nutrients reaching the developing follicles, and just as importantly, it helps flush out inflammatory waste products more efficiently.
So it's a holistic support system for the ovary, potentially even extending the fertile window a bit by keeping things healthier for longer.
That's certainly the potential, yes. It provides a way to proactively manage age-related decline.
Which really shifts the paradigm. Instead of just reacting after a failed cycle, you can intervene beforehand at the cellular level to improve the odds.
Exactly. It's about optimizing the internal environment proactively.
And the actual process, the application.
Yeah.
How is it done? It sounds quite high-tech cellularly, but is the treatment itself complex?
No, actually, the protocol is designed to be very straightforward. The light is applied through the skin transdermally, usually over the lower abdomen to target the ovarian area. Sessions are typically around 30 minutes long, maybe 2 or 3 times a week.
Okay.
There's no downtime needed, and some devices are even designed for home use, making it quite accessible. And we absolutely have to talk about safety, especially when we're discussing anything related to conception. The key thing for listeners to understand is that 830 millimeter LLLT has an excellent safety record. It's non-thermal, no heat, and it's non-ionizing radiation. So unlike UV rays or X-rays, there's no risk of burns, cellular mutations, or systemic side effects. It's very gentle.
That's incredibly reassuring. And it's worth noting, right, that while fertility might be an off-label use in some areas, the devices themselves often have clearance, like from the FDA, for things like pain relief or wound healing.
That's correct. Those clearances, often as Class II medical devices, speak to the fundamental safety profile of the technology itself.
Got it.
And preconception use is considered very safe. Studies show it doesn't negatively affect hormone levels or menstrual cycle regularity. And importantly, there's no research linking 830 nanometer LLLT to birth defects or pregnancy complications.
Okay, so wrapping this up, what does this all really mean for you, the listener, especially if you're facing challenges with, say, diminished ovarian reserve or conceiving later in life? It means there's this non-invasive option that targets the root cause, that cellular energy crisis. It allows you to shift from just reacting to fertility issues to proactively revitalizing things at the molecular level.
Right. The final takeaway is that this 830 nanometer light isn't superficial. It goes deep to literally illuminate and energize aging ovarian cells from the inside out. It empowers women by potentially restoring the energy needed for healthy egg development, offering a chance to reclaim fertility potential.
And that brings us to a final thought for you to chew on. If this targeted light energy can potentially reverse age-related fatigue in cells with incredibly high energy demands, like oocytes, what else could benefit? Think about other parts of the body that rely heavily on mitochondrial health, brain tissue, muscles recovering from strain, maybe even conditions linked to chronic fatigue. Where else could the precision and deep reach of 830 nanometer photobiomodulation make a difference? The broader applications are definitely something researchers are actively exploring.